Thanks so much, Desmond. It's great to be here in London on the Thames. I want to thank Tim and the Canadian Alliance, and a really huge conference. I can't even see the people in the back. We need a reverse camera so that we can see the people in the back of the room. Hello. They're listening. I want to thank Tim and the Canadian Alliance to End Homelessness, first for all their tremendous leadership here in Canada and internationally also, and all the help that he has given us in the US and guidance and over the years. And thanks, of course, most of all to all of you who have taken time out of your very busy work, your dedicated work, to be here to learn from each other about how to do that work in smarter ways, how to improve what you're doing, how to have better outcomes for homeless people. I also want, I know he's gone, but to just thank Joe Roberts for the incredible thing that he's doing to raise the profile of youth homelessness and really to show what we all know, what you all know, which is that we put people in a lot of boxes, but we don't need to be doing that and all the tremendous things that they can accomplish. I am here today as an expert on homelessness because in the US, we have a lot of experience around homelessness. It's been a long road for us there. We've gone from having really no clue of how many homeless people there are. We used to think there were either 250,000 homeless people, which is what the government said, or there were 3 million homeless people, which is what Mitch Snyder said, to having two pretty decent sources of data telling us about the size of the homeless population, lots of research on different subpopulations and solutions and problems. We've gone from having shelter to having transitional housing and shelter to including permanent supportive housing to doing housing first and rapid rehousing, so we've made a lot of progress there. We've gone from only liberals supporting our work on homelessness, the work on homelessness, to having bipartisan support, and maybe we've gone a little bit back to only liberals having support for our work on homelessness, and we're not going to talk about what the situation is going to be after next week. Although we were discussing at lunch how relieved we are going to be next Wednesday, we think. We've gone from having a $700 million federal appropriation in 1987 to about $4 billion spent every year from the federal government today. So you probably know that the US is kind of the big winner on homelessness, and the reason we have all this experience is because we have so many homeless people in the US. We have 565,000 homeless people every night, 1.5 million people in the course of a year. And while we do have a staggeringly large number of homeless people, probably the more important thing to look at is the rate of homelessness in the US. Our rate is about 18 per 10,000 of population. It's hard to compare that to what your number is here because you don't have as good overall data, but it looks like at a point in time count, we're about 60% higher than you are. I know that I looked at these numbers when I was in UK earlier this year, and we had 10 times the unsheltered rate of homelessness as they have in the UK. So nothing to be proud of. But because of those numbers, we have a lot of experience in what to do about homelessness and in a lot of different situations, and we have seen a lot of change over time in our approaches, and I think that we have learned a lot over the years about what to do. And I think that knowledge that we've gained, hard-won, is showing, because nationally in the US, even throughout the recession, since the recession, homelessness has gone down in every subpopulation. So between 2009 and 2015, which is our most recent national number, the nation has reduced homelessness overall by 10%. It has reduced homelessness among individual adults by 9%. In family homelessness down 13%, chronic homelessness down 22%, unsheltered homelessness down 24%, veteran homelessness down 35%. And youth we don't know because we don't have a baseline. Yes, it's good. It should be better, but it's good. let me also say that during that same period, the population of the US went up 5%, and from 2001 to 2014, average median household income in the lowest quintile, so among poor people, went down 10%, but rents of affordable housing went up 5%. So more people, lower incomes, but higher rents. All things being equal, homelessness should have gone up since 2009, but it didn't. It went down. And I think that the reason it went down is because we have used data to figure out what works better. We've used data to build a case to scale up and on those things that work, and because of that, the numbers have gone down. Now, I don't want to overstate what I think has happened. We have not ended homelessness, and we have not made a dent. In fact, we've gone in the other direction on many of the underlying problems that cause homelessness, particularly housing. We have improved on health care. Housing, nothing has happened. But in a period when really we should have had increases, we had decreases. So Tim has asked me to talk today about what we've learned, what we know works to solve, or what we feel confident works to solve the problem, what we feel confident does not work to solve the problem, and what problems we don't yet know how to solve and we need some innovation on. So that's what I'm going to talk about. So what do we know works? First of all, I want to say, as I said earlier, if we had basic housing and healthcare, employment services, if we had a decent safety net, we probably wouldn't have homelessness. We didn't used to have homelessness when we had an adequate supply of affordable housing in the country. So, but I'm not going to talk, I accept that and I know that's true, but I'm going to talk about what we're doing in the emergency system. Clearly, though, if we had more support, particularly if we had more affordable housing, we would not be having these problems. So I'm going to talk about the stuff that works in our crisis system. So and first I'm going to talk about the boring stuff that works, and then I'm going to get to the slightly more interesting stuff that works. Okay, and first, I know some people object to me characterizing it as boring, but the first boring thing is having data that works. Why does it matter that we need data? Why can't we just do the good work, focus on the things we know we're supposed to focus on, not fuss over collecting the data? I think at one level that's true, but for someone like me who's trying to get money and resources and political will behind it, it is not. We need the data, and for three reasons. First, we need data to size the problem. Not just the overall homelessness problem, but the size of the problem among various subpopulations, because we have also found it very effective to break the problem into the smaller subpopulations that, number one, have a more discrete, identifiable solution for them, and also feel much more doable to communities to take on. It's somehow easier, and the nation, frankly, somehow easier to take on the pieces, even if you're taking them on overall. At once. A good example is the veterans. There's been a tremendous amount of political will on ending veteran homelessness in the US. We've made a tremendous amount of progress over it and on it, and the result has been that communities now, several communities have ended veteran homelessness, and now people feel like, see, this shows that we know what to do, that we can solve the problem, and we should just extend those strategies to other communities. The second thing that we need data for is to assess the outcomes that are achieved by the various interventions, to figure out what works best and point to what doesn't work. A lot of people try to do this through program evaluation. We have not found that program evaluation is helpful for this purpose. Program evaluation is really important to the programs, but it doesn't help you compare the different interventions to each other to see what is more effective. If we had unlimited resources, we wouldn't have to worry about that so much, but because we don't, we have to target our resources really well, and that means we have to make sure that every dime we spend is getting the best possible outcome, and we need data for that, not data on outputs, but data on outcomes. And the third thing we need the data for is to measure progress, or lack thereof, because people who invest money seem to like to know that that money invested helped to solve the problem. And the result for us has been that showing we made progress has attracted more money. So in terms of data, in the US, we have gotten Congress to require the collection of two kinds of data, and I know that you're looking at doing these things here too. We started collecting data in the late 90s. The requirement to participate in the collection of data is linked to the receipt of federal funding. So people have to collect the data. And we do the same thing you do. We have the point in time counts that we do in January every year of everybody who's in a homeless bed, quote unquote, and everyone who's unsheltered. So this gives us a snapshot of homelessness. It's not a perfect picture. It doesn't count everybody. It doesn't do a good job of identifying people's characteristics necessarily, but it does allow us to compare apples to apples, looking at whether the population is going up or down from one year to the next. It's relatively consistent. And I know that you're involved in point-in-time counts, and I encourage you, even though they're a lot of work, to participate in those. The second kind of data that we have is administrative data. We call them homelessness management information systems. I know that you have the HIFIS system I just learned about today, and that there's a desk 8, is that right? Anyway, there's a desk where you can get information about it. The administrative data is much more fulsome information, although it does not necessarily include everybody who's unsheltered, so that's where it's lacking. Everyone has to collect that. It gives a much richer picture of people's characteristics, and it also shows you how they use the system. The other thing, there are a couple other things that are interesting about the administrative data. They can merge with other data in other systems if you do the work to let them do that. So you can see how people interact with multiple systems, and you can also see if you're getting cost savings out of housing them through the homeless system relative to their use of other systems. So for example, Los Angeles County, which is a really big county, it's bigger, I think, than 6 US states, they used an administrative data match to find that they had 150,000 homeless individuals who became homeless in the county last year. And the cost to 6 county agencies in the corrections, health, and welfare and homelessness arena was basically $1 billion. So they were spending $1 billion not to end anybody's homelessness, but just that's what people cost while they were homeless. So that is a lot of money for a very poor outcome, 150,000 homeless people. And I can tell you that that has motivated county politicians to try to figure out a smarter way to spend that $1 billion. So the HMIS data has both a local use for planning and program evaluation and so forth, and also a national use. In addition to these higher level kinds of uses of data, of course, it's also critical to know and have data on every single homeless person in your community and where they stand on getting out of homelessness, and have that data be as close to real time as possible. That's the by name lists or other kinds of strategies you may be using, but it certainly should be integrated with the administrative data too, so that you have a longer term view. But it's critical to the effectiveness, to your effectiveness and to a sense of urgency that you know every single person who is homeless and where they stand on getting housed. For us, having the data has been absolutely essential, and we would not be where we are in terms of either money or progress without that data. Another kind of boring thing that we've been working on in the US is the creation of systems. So as here, most of the homeless assistance, I think here, I should say I'm no expert on the Canadian system or approach to homelessness, so if what I'm saying is irrelevant to you, you'll just write it off. I can't assess whether it's relevant or not. But in the US, the delivery system on homelessness is mostly nonprofits, some government agencies. In the 90s, we had 50,000 individual homeless programs operating separately to deliver federal assistance, each deciding who they were going to serve and what they were going to do. They didn't coordinate. They were all independent entities. They had their own missions, boards, funding sources, and so forth. That was in the 90s. Then we got the Continuum of Care. You may have heard of that. And that improved coordination in the sense that every program in the community knew what every other program in the community was doing, and they could identify the gaps, but they didn't actually coordinate amongst each other. They weren't a system, so everybody still did what they wanted. There was a lot of creaming. They weren't required to really fill the gaps. It wasn't also a system at all from the point of view of the consumers. The communities felt they had a system, but the consumers had to still go from door to door trying to figure out a place that they could stay. And there was no accountability for community-wide outcomes like reducing the number of homeless people because the community really didn't share any outcome goals. So now we're creating systems at the local level. What does that mean? First, it means the community sets joint priorities. And generally the priority is that people with the highest needs will get the help first. That's mostly because of federal requirements. But this is very important because what we've seen is that left to their own devices, most individual programs will serve the lowest need people first. And they'll often screen out or discharge the highest need people. Why do they do that? Well, intuitively, it makes sense sometimes to people that if you help those who need less, you can help more of them, and you can get them out faster, and then you can have the system left for the higher need people. And also, often the programs are not really resourced to help the high need people. They don't have the money to provide services to people with complicated problems. And also, serving lower need people gives you better outcomes, so the program outcomes look better. But the community level outcomes or the province level outcomes or the national outcomes do not look better when you serve the lowest need people first. The people with lesser problems generally get out on their own very quickly anyway, without much help from anybody, from our data. And also from our data, serving the lowest need people first doesn't make a measurable difference, and it costs a lot more. So for example, a big study just came out in the US, the second iteration of it, Family Options Study, looking at various interventions for families and how they relate to each other. And it found that transitional housing, which is a service-based model largely, and tends to serve the lower need people, because other people get kicked out of it usually for not being compliant with services, cost a lot more and had much longer stays in homelessness and no better outcomes than either shelter or rapid rehousing, which are based on the notion that people are largely homeless because they can't afford housing. So what actually works to lower the number of homeless people in a community is to provide the most assistance to the people with the highest needs, because they're the ones who tend to stay in the system the longest and clog it up so you can't move other people through, and that reduces the numbers. So back to the systems. Our systems now assess people in the same way. Everyone in community uses the same coordinated assessment tool, which was largely is the SPDAT, a gift from Canada. And they develop also a coordinated entry system that then assigns people to available spots. So the system is to prioritize, assess, get high need people more quickly to the proper intervention, get low need people more quickly to the interventions that work for them, rationalize the use of resources, try to maximize the impact of resources, and fill the gaps. Also, these local systems make it easier to leverage other federal funds, mainstream funds. They make better use of the money. It's definitely not perfect yet, but I think it's making progress. And the final sort of systems level thing is the plans. Plans to end homelessness. You don't just want data and systems, and we're having this argument in the US now with respect to what ending means, because you can easily have systems that are effective but that maintain the status quo and don't bring the number of homeless people down to zero or something close to zero. You need plans that set goals to say where those systems are headed, where you're trying to go with it if you're going to end homelessness. And a few things I think that we've learned, there's been a lot of plan efforts in the US that's key about the plans. One is having concrete numerical goals, like having homelessness, cutting it in half, or ending homelessness, dates by which the plans are going to be completed, a determination about who is responsible to implement the provisions in the plan, and a decision about who is responsible to pay for implementing the provisions in the plan. Although, of course, everyone is different in terms of what works, generally we see that plans that have a lot of verbiage are not the more effective plans. Lots of places spend a lot of time creating long descriptions of the problem and describing a lot of strategies that probably would work if they could ever be implemented, but are very unlikely to be implemented. In my experience, as soon as implementation starts, all the language that people spend a lot of time and energy developing falls by the wayside. One of the best plans I've ever seen was really just a grid. What's the goal, who's going to do it, who's going to pay for it, when's it going to be done. Two quick examples. On our side, the most important one is opening doors, which was the Obama administration's plan to end homelessness that they approved at the beginning of the administration. It was basically to end chronic veteran, family, and youth homelessness by the end of the administration. They didn't make it, but the plan had a huge impact, or as Donald Trump would say, huge. The plan, it was amazing also. I would tell you about it, but I'm not going to. I am the only person that is capable of ending homelessness in the United States. Yeah. Anyway, we can't help ourselves. And you probably can't either, because you have to listen to it all the time too. The opening doors had dates, goals, tasks, responsibilities, and funders. It focused attention of the government agencies because the White House held people accountable. It set priorities. It gave people goals to work for, which resulted in all kinds of good things happening. It reorganized government approaches. For example, it made VA and HUD work together for vets. It's making the healthcare system and the housing system pull together. It's making the child welfare and the housing system pull together for youth. In order to get stuff done, they started having to work together. So it leveraged existing resources better. There was a lot of innovation about it. Like we had this mayor's challenge on veterans. I don't know if you heard about that, but the White House asked mayors to make commitments that they would end veteran homelessness by a certain date. And there was a lot of competition among the mayors, and a lot of stuff happened because of that. It leveraged technical assistance resources and focused them much more on urgency, on fast results, on getting things done. And the administration made very hefty funding requests to Congress, not all of which were successful, but some of which were. So we got a lot more resources. The plan originally had a whole lot of recommendations. You can look at it, but most of those fell by the wayside. I think, though, that they were essential to getting the buy-in of the agencies at the beginning. Honestly, I don't think the plan would have passed if they hadn't had all of those, but most of those were not really operationalized. The main thing that was operationalized was the goals. Just quickly, another interesting example is Utah. Utah's kind of been well known in the US because they decided to end chronic homelessness, and it's not a state that one might intuitively think would take a housing first approach and do a really awesome job at ending chronic homelessness. But in fact it did, and they reduced chronic homelessness by 91% in Utah. But there's a little bit of a cautionary tale in that too, and that is that the leadership matters even when you think you have things institutionalized, which of course what we're always trying to do is institutionalize things, so it's not so subject to the political whims. Utah kept up their progress on chronic homelessness through several governors, but the leadership has kind of disappeared, and more recently there were some new local elected officials in Salt Lake City, which is the majority of the population of the state. And these new leaders are just not interested in the chronic homeless initiative that people have worked in so long. It's not interesting, it's not new, it's not shiny, they can't put their name on it. So they like the idea of innovating even when innovation actually isn't really needed on the issue of chronic homelessness. So they've gotten diverted to building some big multi-purpose shelters and service centers, although I think now they're drifting back. So I think the lesson of that is that you do have to expect that elected political leaders are going to want some new framework, and you have to figure out how to build on what you already know, but still give them wins that they can hang their hats on. Jeffrey Sachs, the great international anti-poverty fighter, said, it's not that we don't know the solutions to poverty, it's that we don't do enough of them and we don't do them long enough. And I think that's a lot of the challenge we have on homelessness. I read a recent study here that was done here on 4 of your homeless plans that pointed out the fact also that the municipalities don't have the wherewithal to end homelessness on their own, and that is, of course, also true in the state. So I think that the work that's being done on the national strategies is terribly, terribly important. And I also just want to reiterate what Tim said earlier, that the people in this room are the people who care about homeless people. And politicians are hearing from a lot of people who care about a lot of different things. And they may be worried about homelessness, but if they're not hearing from people, it's going to start to fall on their agenda. Nobody else besides you all is going to be telling the politicians that they should be doing something about homelessness. You're it. So really, I think they've made it incredibly easy for you to let your elected leaders know that you care about it, and you have, as he said, that you have boards that probably know them. You have consumers also that you should empower to opine about this with elected leaders. It really, really is important for you all to stand up and talk about the need to do something about this problem. So data, systems, and plans, those have all had a big impact. What are some of the other things we know work? We know that permanent supportive housing works to end homelessness for chronically homeless people. In the US, we have done a lot of permanent supportive housing, 300,000 units. We haven't always given it to chronically homeless people. About half of our permanent supportive housing did not go to chronically homeless people. 72% of our HUD funding, which is the big pot of money, goes to support the permanent supportive housing. That poor targeting is really stopping us from making progress on homelessness now, because we don't have the resources. We can't get the chronically homeless people into that housing, and we can't get the people who have that housing out of that housing. So you really, the lesson there is you really have to attend to targeting and make sure that the people who you're giving the more expensive interventions to really have to have those, and you couldn't end their homelessness with less. We know from evidence that Housing First works. In this case, I mean the specific pathways model of Housing First, because that's where the evidence lies. We know that the more broadly defined Housing First philosophy also works, that we should house people, even if they have active problems like using substances or active mental illness, even if they're not employed, because they're going to do better and the services are going to work better once they're in housing. We know that rapid rehousing works. I think you have a really short length of stay here, so I'm not going to go into the rapid rehousing, but that is a really big intervention in the states that we're starting to build some more evidence on. What it really means is that we can help people faster at a much lower cost. Rapid rehousing is about $4,000 to $6,000 per episode. Shelter is about $9,000 to $11,000 per episode. Transitional housing is $32,000 per episode, and the outcomes are indistinguishable. So if we could help someone for $4,000 instead of $32,000, that's 8 times more people. Is that the right arithmetic? That we could be helping. Critical time intervention and trauma-informed care, also evidence-based practices. What do we know that does not work? Evidence is growing that single-site transitional housing, I'm talking about single-site, the sort of 2-year facility-based accommodation, does not work for most people. It has few outcomes other than giving people a place to stay for 2 years. There is some evidence, though, that it does work for youth. is short-term post-recovery housing and some domestic violence victims who want it. But for people who largely have economic problems, it does not work. We are backing a lot out of transitional housing and shifting resources to permanent supportive housing and rapid rehousing. We have evidence that high barrier shelter does not work. Low barrier, low rule shelter that focuses on helping people with housing instead of holding people accountable for a lot of rules has much better outcomes. There's also some emerging evidence that we need a lot more shelters. This came up in a session I was in this morning, that take pets, that take partners, and that let people keep their belongings with them. These things work better. We have some evidence that street outreach that is not focused on housing doesn't work very well. We have evidence that campuses and one-stop shops don't seem to make a lot of difference. That's a very popular thing in the US now. Co-location may make sense, but it's not by itself something that's going to reduce the number of homeless people. You could do it, but don't think it's going to solve all the problems. So wherever we have evidence on things that either work or don't work, we need to scale up or scale down accordingly. There are also some places where we could use some innovation. One is on episodically homeless people, so that we know that permanent supportive housing and housing first work for people who are chronically homeless. There's this other group that was part of the typology that identified chronic homelessness of episodically homeless people who are in and out of the shelter system. They often get permanent supportive housing, but they don't. They tend to be younger people who are actively involved in substances, and they often have other places to stay. They enter the shelter periodically, often because they need to save money for other purposes. In the US, they do get permanent supportive housing, but they often don't do very well in it. They're often bad tenants because they do a lot of partying or they don't fulfill their tenant responsibilities. They get repeatedly evicted from permanent supportive housing. They sometimes really don't want the responsibility of permanent housing. They prefer housing that has fewer responsibilities, it's less demanding financially in terms of permanency. I'm not sure we have the right model for them, and I think we need to do some innovation around new models for them. I think we need more innovation around rent subsidies. In the US, we have one recipe for rent subsidy. You pay 30% of your income for the rent, the government pays the difference between the rent and that 30%. But the rapid rehousing, which is short-term rent subsidy, has showed us that a lot of people can stay housed with much less. We need some new rental subsidy tools to be trying. I think we need innovation around how to match up housing and services in permanent supportive housing, because people in permanent supportive housing tend to need a lot of services at the front end, but once they get stabilized, they don't need so many services, but we have the services embedded and it drives up the cost of housing. So I think we need to think about that. We need some more innovation around house sharing. Many of us share housing when we're young or when we're old to reduce costs. In the US anyway, we never work with homeless people on sharing housing to reduce costs. Everybody's supposed to get their own place. I think we could do some innovation there. We need to do a lot more work and innovation around what to do about racial inequality in our system. We're good at seeing that racial inequality broadly causes people to become homeless. We're good at educating ourselves about the racial inequality, but we're not very good at operationalizing the things to do in our own system that help with that cause of homelessness. And finally, in the US, we need to do a lot of experimenting around linking people up with employment. So in the US, we've made a lot of mistakes on homelessness. We didn't focus on housing early enough. We invested way too much in transitional housing when we had no evidence of its impact. We neglected youth, and we creamed. We counted on nonprofits and charities to do the right thing, but we didn't take into account that they often aren't resourced to do the right thing, and that since no one organization can do everything that a community needs, we had to figure out some way to organize a more broad approach for homeless people. But we've learned a lot from our mistakes, and I think we've learned a lot from other countries We've learned a lot from Canada, for example, about youth. We've learned from Australia about person-focused service models. We've learned from Europe about the creation of systems. There's a lot to be gained from sharing. But if I had to distill all of our experience and that of other countries that I've learned about what to do, I would say first, it would be to focus everything on getting people back into housing fast and connected to whatever supports, personal supports and services they need and are available in the community. For every dollar and every minute that you spend on the homelessness system, on the front door, you should spend at least that much on figuring out how you're going to get people out of homelessness and back into housing. Do it systematically and collect data on it. And the final thing is, again, don't forget to advocate. You have to speak up for homeless people. You have to help them or empower them to speak up for themselves, because otherwise we're not going to create the political will to do it. I got involved in homelessness not for probably the much better reasons that all of you got involved. I got involved because when I saw it starting to emerge in the 80s, it just seemed like the most solvable problem to me. It's like, we'll just wrap this up and move on to child poverty or something. And now it's not 20 years anymore. I have to update the bio. It's more than 20 years. But it still seems very, very solvable to me. The US and Canada are wealthy nations that don't need to have their streets crowded with people who are sick and homeless. We don't need to have any children who are homeless, any disabled people, any veterans. We really don't need to have anybody who's homeless. This is so solvable. So I'm glad to share what I know with you. I appreciate learning from you, and I look forward to learning more in the next couple of days. Thanks.